So hello everybody. We are here again today together to speak about some nice drinks, and this is how to rebalance, harmonize, and enhance authentic beauty. I'm going to just like keep talking some nonsense at the beginning of this, just while waiting for the rest of the people to actually arrive. And I wish definitely to tell you big thank you for coming here because it definitely it definitely means a lot to me and the company. That actually you're supporting us and actually seeing that there is benefit for you in this webinar. So I don't know where you're from, but I hope that you are all over from the different corners of the world. And at the end of this webinar, as I stop on the last slide, we will have definitely time for doing some of the questions and answers. So what I would like to ask you is actually to go down there and the Q&A box and write your questions, which I'm going to be very, very glad to answer, if of course I know. If I don't, I will ask somebody smarter than me. So, Swissell is the owner of the Apriline brand, and they are fillers that I like very much because they are very safe and secure, and they give, uh, you know, an opportunity for you to definitely be on a safe side when you actually inject them inside of the face of your patients. And of course, in the current advancements, I'm going to actually tell you a little bit about some more, let's say, advanced thinking, because when actually we start injecting is maybe just at the first day that we start injecting, not as easy, but then it becomes very easy. Then the problem is not just injecting, it's just understanding of how we can improve our injection pattern and how we give it most to the patients when we actually inject, because this is then the real treatment, not just the injection. Of course, when we're speaking about beauty, and I'm so beautiful, thank you. I'm definitely somebody who does injections over the last 15 years, and I've been a speaker at the major conferences around the world, like AMWC and IMCAS, as well as other conferences. And thank you so much for also calling me as an invited speaker. I come from Serbia. Belgrade is the city where I live. And I've been to last year to Italy, and the guy told me, you have most beautiful woman there. Maybe because majority of them are actually my patients. So how I see the concept of a facial beauty, because when I travel around, I meet a lot of different people, different cultures, different races. And actually, I found out that the beautiful face cannot be defined by the mathematical formula because it reflects the bony structure, position, and volume of the subcutaneous tissue, skin quality, and the personality of each person. The harmonious proportions of the facial thirds and other features such as eyes, nose, lips, chin, and neck are, of course, the paramount for the attractive face. But if we want to do like something that is most common for all beautiful people, we can definitely say that the harmony, symmetry, and balance are the things that are the key of perceived attractiveness and facial beauty. But let me tell you a story about a car that actually showed here on this slide. what do you see about this car? Well, it's a very sporty, but also very luxurious car. But the main thing about this car, it actually is very angled. It has a very angled looks, the angle everywhere. And then what you actually have, it reminds me of something that is completely different, and that is a skull. So how actually a skull reminds me of a car? Because also a female and the male skulls are completely different. Of course, completely different if we go to the tiny differences. And here, a male skull is like this Range Rover because it has all the facial features that are straight with angles, and of course, the volume that is a big one. Then, of course, what we have other types of the cars that are more nice with a lot of curves. And also what I see is actually they look a lot like a female skull. So I'm going to tell you a bit more about the differences between the male, what you see on your left, and the female, what you see on your right skull. Because these differences are going to make you a major, major impact on you as an injector when you actually inject during that process, because the understanding of the differences of the gender dysmorphism is very important. Unlike you, of course, want your patient to change the gender, which is something that today we speak a lot, and you can see that in medias. So what I'm going to talk today is about real sex differences, meaning the ones that you are born with and not that you think of. Okay? So here we have a male and a female. But before that, there is the structure below all of the faces that I know. And of course, this is the skull. But what we see is the beauty on top of that, because on top of the skull, we have, of course, the soft tissues, the muscles, and the skin. And if we actually do not have enough of the supporting tissue, the base, like we see here on this orthopantomograph, we can see that this is the skull without the teeth. So the teeth are missing here. And of course, the alveolar ridges are also deseeded, meaning that they do not provide the enough occlusal width. So on the right side, what we see is actually a picture from the Lucas Cranach the Elder with the name Old Man and Young Woman. And you actually can see very distinctively that the chin is pronounced, but the beauty of the face is lost because there is not enough support in this area. When we're speaking about the glabella, we definitely can see the difference in the area of the patient, that is the male one, and of course the female. In the male patient, we can see that actually the glabella and the frontonasal suture here are much more pronounced, and that the supraorbital rim is very prominent in a male patient. But then in woman, on the other hand, we have the forehead that is straight, the glabella here, like here, is very delicate. But here, as you look at me like this, you can see here, nose straight, then I have like a dent here, that the supraglobular ridge that is very pronounced, and then I have this very flat forehead, unlike females that are completely different and a more vertical, as you can see here on this slide. On the next slide, what we can actually see is this forehead. So as I already told you, the forehead in males is, just like mine, a bit more to the retrograde. And then it is also not very straight, but a little bit bumpy, as you can see here at the supraorbital rim, that is very well pronounced. But with the females, on the other hand, what you can see is that the start of their forehead is pretty straight, and their forehead is definitely convex and oval, which is something that is a difference with the males and the females. When we actually see that in the normal, like people with structure, not just the skull, we can definitely see on the male figure what I was talking you about. The first thing, the straight nose, then this area of the glabella, then it goes totally up and then backward and straight when we're speaking about males. But when we're speaking about females, what you can actually see on the picture here is actually that this glabella is like very, very nicely done here, that we have the nasal region that goes up without big, like a big hole here, then it goes there vertical, then convex. So this is something that is also very important. And when we're speaking about the real patients, unfortunately, we have something that is like a female with the male features. So what we can see here is actually a female that has a very pronounced supraorbital ridge. Then we have the part of the upper part on top of the supraorbital ridge, we have the depression, and then, of course, again, we have a convexity. So this looks more like a male forehead than in a female. But that's why we doctors, the injectors, are here to actually help. When we see that there is a difference like that, we can inject a proper hyaluronic filler in this area and actually make it more beautiful. For this area, I always go, I prefer actually to go here with the needle, because in this area, the supraorbital and the supratrochlear artery are generally more superficial. So when I go with a needle, I go all the way deep to the bone, and then helping myself actually achieve a more safer injection, because when I touch the bone, I aspirate with the hollow virgin needle, and then I can actually have more easier and nice trajectory of the needle than with the cannula. When actually I apply a cannula, which I can also do in this area, the problem is that in this area we have so many layers, up to 10, that are actually very condensed. So the cannula does not easily move, and it's more painful than if we are doing it with the proper needle. So this is why I choose the needle. Of course, doing a bolus technique in this area, what actually happens is that actually applying the bolus, the hyaluronic filler creates a bump. But don't worry, that bump is pretty much easily completely moved just by pressing it on top, either with your finger or with, of course, the gauze and the finger above that. So you can definitely have that. And then on this skull, what we have seen is actually a very nice difference that you have to take care. A very, very important thing. On your left side, there is the skull of a male, and you can definitely see that on this part, the part of the maxillar bone and of course the zygomatic zygoma, they are in this part very straight. It looks like we have on the frontal, we have the maxilla. On the side, we have the temporal bone. And in between, we have the zygoma. So actually, all of those sides are pretty flat. This is the male. And on the other side, here, we have a female. So what you actually see here is that maxilla also with the zygoma, unlike a flat surface, it creates actually a very oval surface. And what we see also in patients when we look specifically from above, just like here it is that in males, we see that this area is pretty flat. And this is how it should be. So if we have a male that actually have a depression here, okay, then we fill it up, but not to make it convex, but rather flat, because this is masculine. But when we have a female patient that here has both the depression and the flatness, then we definitely say, okay, this is definitely the right indication that I'm going to inject in this area, making it more pronounced, more convex, and actually more feminine. And this is something that the patients, the female patients, are definitely going to have it that way and enjoying so much. So you can once again see here the difference on the blue line. It is more flat, and then just like almost a straight angle, and then flat again. But the red, it's all convex and nicely rounded, because this is the female way. In the lower face, what we can definitely see is again some of the gender dysmorphisms, and these are very important in this area as well. So what we actually see is first the size of the mandible that is pretty much more pronounced in males than on the females. Then what we can also see is the size of the ramus. Ramus mandibula is also much more pronounced, as you can see on the left picture than on the right picture. You can see that ramus is much more enlarged. And also the difference is the gonial angle, and we will see in the later slides what are the exact angles, the degrees of actually the gonial angle when we're speaking about the male and the female. But of course, it's not only about the bones, the tissues that are actually over the bone are also making difference in the gender dysmorphism. When we're speaking about the males also have a thicker skin, but also less subcutaneous tissue. But then when we go to the muscles, specifically the masseter muscle and the temporal muscle, are much more larger and hypertrophic than in females. When we are speaking about that, we then have also the difference in how we actually perceive the look on the patients. And in the male, we see this black, the blue square. And actually, the blue square represents how we see the male face. The male face, for the beholder, for one that is actually looking at the other, is more square, unlike on the right side, we have this red oval. It actually shows us that the female face is more rounded and oval, and this is something that again is very interesting in speaking of the differences with the male and the female. Also, the mandible and the height is definitely different. So we can see that specifically in the patients that are male, this part of the mandible is much longer, and of course, combined with the maxilla, we have this lower third that specifically in males is much higher than in females. You can see this by, okay, so I have a receding hairline, so it's not like the best here, but if you go like this is my upper third, then my mid third, and they are the same. And then if you see like this is my lower third. And this, you can see that actually my jaw is actually, my chin is actually coming out of these thirds because it's much higher. And this is actually how it should be when we are speaking about the males and the females. And then the look of the mandible. The mid face and the lower face actually presents a more clear-cut angles, irregular surfaces, and a little anterior projection in men. And also the mandible is larger, it's more angled, and has a very square shape. Whereas, of course, females, we have that both the mid face and the mandible are more subtle, discrete, and of course, rounded in shape. Also, when we are speaking about the let's say chin, and you can see here that the chin in females is rounded and in males is pretty much square. We also want to make like what would be an ideal width of the male and the female chin. And usually we're speaking about either in males that would be the length or the width of the mouth, and then we have those vertical lines that goes down, that are actually helping us showing the width of the males. But keep in mind that the soft tissues are easily changed, and it is better to look at actually the fixed points, and the fixed points are on the bone, and of course one of the parts of the skull are at the feet as well. And as you can see, I would definitely rather than the angles of the mouth, though the width of actually canine teeth. So you take the canine teeth. These are the teeth that are the third ones from the mid part. So we have the first incisor, the second, and then we have the canine teeth, and on the lateral wall of the canine teeth, and then we put it down, and this would be for males. Then we have for the females. So when we're speaking about the females here, right? So what we have here is the rounded, but a study in China where they actually asked like thousands of people how they would like the chin to look like, or how they prefer and think that this most beautiful chin, they said it was either the oval or the heart shape chin. So actually, if we want to improve the beauty of the chin, we can also inject in the chin itself for the females as well. But then the width should be, we usually say, the width of the nose. But once again, we can definitely see that there is a quite difference in the width of nose in the Caucasian whites, and then sub-Saharan Africans, and of course the Far Eastern Asian people, where they have much bigger noses than we do. So in that part, it would be very clever to actually do that on the width of the nose. So what we have to do is actually we take the skeletal fixed points, and these skeletal fixed points, the best ones are the medial cantuses, and they go down just touching the piriform foramen and going down. So actually it is going to show us what would be the width of the chin in females, and of course previously in males. Also, great thing about the differences of males and females is the gonial angle. The picture here shows, of course, this beautiful woman called Angelina Jolie, and the degree is 123 in her case. It's still feminine, but if we see on the picture here, the masculine gonial angle is from 100 to 120 in male, and in females from 120 to 140, but she is almost next to the male gonial angle. And of course, there are differences in the angles, of course, of the newborns and the elderly people. So while we age, there is definitely the change in the gonial angle, and actually the gonial angle when we are young, not newborn young, but young and younger. And then we have a very like almost straight, close to 90 and 100 degrees. And then that is actually going blunt. It's opening up. And also what we see is the change, not just about in the bone resorption, but also in the superficial tissues, such as the loss of fat pads and skin laxity that also changes the jaw structure, okay? To summarize, when we are looking at the patients from the frontal view, we can definitely see, as I already told you, that the thirds in the females are almost identical. But when we're speaking about the males, the lower third is much more pronounced and higher than the female. But also there is another thing. When we are looking not now at the height, but now at the width, we have the bizygomatic width here and the bigonial width here. And when we are speaking about the females, there is a quite difference between the zygomatic to the bigonial width in the way that this zygomatic width is much larger and more wider than the gonial angle. But then we go to the far right side of the slide, we have a male that we can actually see, and this is what we already talked about, and that is the square look. And that square look comes from the zygomatic width is almost the same as the bigonial width, and of course, with the addition of the soft tissues on top of that, the jaw itself, and then the muscles on top of that are definitely making the more square line. And of course, we definitely see that every day while we walk or while we looking at the famous actors on the TV. We can see here the very famous actor George Clooney, and you can see him in different phases where different ages, and you can definitely see that his upper and the mid third are almost the same. And then this lower third is much, much longer. And this was before when he was younger, and now that he's older, but he still look very, very attractive. And then, of course, there is also a little trick. If we don't want to inject the lower jaw or the jawline, the chin, there is also the possibility to actually grow some beard, and we can see that in the famous actors as well. They grow beard because growing beard is actually the most easiest way to actually highlight and improve the jawline and the chin in males. But there's also another thing. In this psychological journal, we have seen that actually the face is in cohort, in the combination, like that actually the face predicts the company profits. And what you see here on these slides here, that actually all the males here are very with the faces that are very dominant, that are very increased. And also, it is said that the face actually is connected to the electoral success, because the chin is critical component to the perception facial attractiveness. Okay, and of course, how we do see that? Also, in the West Point, there was a study of the facial dominance where actually the measurement were taken on the graduates' portraits, and it is known that it is related to the cadets' ranks at the military, this famous military academy. But it has not been reported to be that related to their ranks in the later career. But with improved methods, data collection analysis, it has been shown that actually cadets' facial dominance, while still unrelated to their ranks at mid-career, it is related to the promotions in late career, which is very, very interesting. I found it very interesting. And these results actually suggest that the absence of physical features from current models is actually a serious omission, and the problem in the work where facial dominance is very important, and that is military, but of course not just military. The every single day there is a financial war every single time, so in life and business as well. And you can see here why the chin is a critical component to the perception of the facial attractiveness. You see this guy with completely absence of the lower third of the face, not absence, but like completely decreased size of here. And then when he actually changes growing beard in this size, it is creating a perception of youthfulness, and this augmentation is actually helping so much with the retrusion and the improvement of this previous facial feature. So this is very important. Also, this is another guy. So this guy here, it helped him to actually have a much better facial feature just by growing beard. And you can see that in this area, the lower third is decreased, and the quite a difference is that there is the change in the facial attractiveness before and after. This is another guy. So he grew a beard and of course lost a little bit of weight, and then this 22-year year-old guy at that moment was told by his barber to actually grow some beard, and then with a little lifestyle choices and everything, he became a model. And this is definitely a difference what actually the increased size of this in males can actually do to what we see as the facial appearance and the dominance. And of course, the most like advanced people that actually see the character of any man and woman are definitely the guys that actually draw the comic books. And these are some of the famous superheroes from my youth. And of course, they are most famous. And we see Batman, Superman, and Wonder Woman. And all of those, as you can see, they have the chin that are appropriate to what I was talking to you just a moment before. You can see that the width of the chin on Batman and Superman is to the width of either their mouth or their canine width. And of course, when we're speaking about the Wonder Woman, she's wonderfully beautiful, and we can see that her chin is much less wide and almost very pointy to the extent of actually being wide to their width of the medial canthus. Okay. Of course, we can see that in the all Marvel and DC Universe movies that are here and that you can actually see. Of course, there is another guy that we see on the Cartoon Network, and this is the Crimson Chin. And the Crimson Chin is also a comic book and a cartoon that you can see that he lives in a city called Cincinnati. Okay, so it's like Chin, but it looks like Cincinnati, but with Chin. So he's protecting his fictional universe from a variety of different metal or body part themed villains. But what is also interesting about is that his voice is given by Jay Leno. He is a very famous like a speak host for the late night comedy, and he's very famous for actually having a lot in his real life. So also those people saw that the chin is also important in this area as well. But let me tell you that actually, if you just inject just the fillers, and then it is like if you only have a tool that is a hammer, it is very tempting to treat everything alive if it were a nail. So actually, it's not everything to just enlarge. There's also something about creating an improving the quality of the skin. That's why we have inside of the Apriline, we have the Hydro that is for improvement of the hydration, the quality of the skin, and also to get the best results, what we're going to use is to combine them. And I'll show you how. Of course, the very, very important thing is to avoid the facial overfill syndrome. Just like I said, if you have a hammer or in your office, if the only thing you have is just a filler, you tend to oversize, over-inject, because there is also the tendency that the skin looks a little bit better because it is stretched because of the higher volume. But then when you look the face at the whole, it looks not so much. But of course, it is just the story of today. Why? Because in today's society, more is better. It has always been a mantra of the 21st century, because more online shopping, more social media interactions, more likes, more followers, and then more binging of Netflix. But in aesthetic medicine, more is not always better when it comes to dermal filler injections. What I can show you is just like a screenshot from a website where it is said how many of the mLs you need for the face. It is 1, 2, 5, 10, 11 for a liquid facelift. But of course, we can go to even bigger extremes. And this magnificent doctor called Maurizio De Maio is an amazing injector and a thinker that, of course, is showing you not that you should do at one point 24 milliliters that actually he does at almost every single live demo, but it is actually showing you that during the aging process, we need to give and to replenish as much as the volume as it is needed. And we know that actually there is definitely a lot of volume that is lost during one treatment. But you have to keep in mind not to put it just like on a specific part to enlarge it too much. Then we can go to the facial overfilled syndrome. Because if you actually apply those 24 milliliters, and I did that a couple of days ago. There is but the thing is, if you apply it on the whole face beautifully, that you don't pinpoint just certain structures, then you can have a beautiful result and not something that we call a facial overfill syndrome like this. So this is the flower horn forehead, broad nose, avatar nose, flying saucer face, the witch chin. And believe me, I've been to the airplane not long ago, and and a woman next to me was looking like this, and I was like, "Oh my God, it's not something that you should look like that." But this is happening, and this is happening because either the patients are asking, "Okay, can you do this for me?" Because I saw it on social medias, or the doctors have actually the point to do it as well. Once again, Angelina Jolie. So from the her one of the latest movies, see what we would say is the perfect jawline, but of course this zygoma here in here, of course, is too over pointed. But if we make it beautiful, we can make it even go with the everyday life. Here we also see some like not the best works of the most famous actors that went paid like a lot of money for the very overpaid plastic surgeons in the USA. I don't know to whom she went, but we can definitely see the result. For me, she looks like a fish now, maybe a piranha, something like that. But the good thing, there are also the doctors that definitely know the way of doing it. And then after everybody saw this, she went to another one, and then everything was actually rejuvenated, treated, and the damage was actually completely removed. But have you actually seen this woman on the social media? I mean, she looks very interesting, but for any injector, just like you and me, maybe this is a bit too much. The question is like, okay, I can understand that some people actually want to alter themselves, but the most interesting question is like, are there any actually doctors that do things like this? This is the main question. And this is, let's say, Andrea Ivanova, a Bulgarian influencer, that shows her lips after 20th procedure. They're so huge. But of course, we don't work with just with females, we work with males as well. And you can see that also the males can have almost the same or just a little bit different facial overfilled symptoms. And this is, they say, the pharaoh's chin. We can also have the Dalek lips. And you can see these guys on the social medias, internet as well. But you know what is the problem? The major problem I see in these days is actually patients coming to my office and they are demanding results that are unrealistic. Why? Because they have seen somebody doing a before and after that is actually created as far as a God can go, but of course by the use of artificial intelligence and the filters. And what we see on these pictures, the first one, you can see the crossing, and the white and the black lines on the crossing are actually going up to her waist because everything was lifted up. On the second person in the picture, we see that she has a very nice waist and a big bottom. But then if you look at the part of the window where we see her reflection, what we see is that it is not the same thing because it is completely redone by Photoshop or something else as well. On the third picture, we see almost AI made a picture, but not. It is just a person that did too much of the facial improvement filter that actually removed all her facial features, such as the wrinkles, the pores, and completely the any hair as well. So she looks very cartoony-like. And then, of course, on the last picture, we see how this filter can improve the quality of the face and tighten everything up. And then, of course, we see what it definitely looks like without the filter. And it is a big problem. Of course, there are some things that you should know how to not treat the patient to look overdone, and that is to avoid the excessive amount of volume in a specific points and keep everything in proportion. Of course, feeling the temples also, then feeling the cheeks and what is the cheek positioning, and of course, the high cheekbones. So instead of actually implementing like a huge bolus of the product inside a certain point, let us think about the multi-layering technique. The multi-layering technique would be the first thing. You go to the deep fat with the Apriline Forte. Applying the Apriline Forte in that area is going to create the volume. But of course, what we know is that not just the volume disappears in the deep fat, but also in the superficial fat. In the superficial fat, we have the loss of volume as well. So what we're going to do is actually implement, apart from Forte in the most deep area, then we're going to inject the Apriline normal in the layer number 2. Injecting it in the layer number 2, what we get is actually creating a beautiful volumization in this part, recovering and completely covering the roughness in this area as well, and also creating some natural, beautiful look. Because actually, when we move like this, the beauty of the face will completely stay and be nice and beautiful. But we don't have to forget the last part of the puzzle, and that last part of the puzzle is actually using all three. As I said, what I see a face is like this sandwich or a double cheese burger, and I can see that actually this lower bun is the bone, and then on top of that we have the cheese, where we do implement the Apriline Forte. So these are the deep medial fat chip compartments, and then we inject the normal on top of the smus, in the area of the superficial fat cheek compartments. And then what we also need to do is to implement the Apriline Hydro in the most superficial area of, again, a soft tissue layer number 2, meaning the superficial fat, but with usually much smaller cannula and the much more superficial, already touching the reticular part of the dermis. So this would be the sandwich technique. By this, you're going to recreate the volume that we lost, because we don't lose the volume just in one point of the volume, but in the all parts, and then we'll recreate the beautiful volumization. Of course, the filler, Apriline filler Forte is going to last much longer than the normal. So you have to tell your patients that actually they should come to the visit like in 6 to 10 months for a little touch-ups for actually you to improve their skin and the condition in the best possible way. Of course, for the Apriline booster, the Hydro, you should do it like every 3 to 6 months, depending on the quality of the skin. What I like about those fillers, as I said, are that they are making volumetric rebalancing, the filling of the roughnesses, and of course, not just like that, but the promotion of the improvement of the collagen and elastin in the matrix, and they're going to last long enough if you apply them in the proper ways that are there. Of course, adductor satisfaction is very high. You can see on this graphic here, as well as the high patient satisfaction. When we're speaking about the longevity of the filler, usually this 9 months mark is actually the mark where the patients are actually already ready to do something else, and they are just ready to do something else. They're not unsatisfied with the result, just ready to do something else. And this is the point where actually around the 9th month, they're going to come to you. But you can see actually here that the depth of the nasolabial fold that was treated with the Apriline Forte stayed very improved up to 58% of the depth of the nasolabial fold is significantly reduced comparing to the left side when Apriline Forte was not injected. So it's still there, but we are not satisfied with super satisfied with the result. We need a touch-up, and this is very interesting thing to have in mind. The fillers are lasting much longer than 6, 9, or 12 months. They can last inside of the body up to 5 years at least. But what we see is actually that, of course, we have the loss of volume during the time. And of course, what we see is actually that the patients, us, are aging. So everything that in combined, we have to do some little touch-ups that are in the periods of the 8 to 9 or even 12 months. And also by the image analysis, we can see actually there's the 80% of the filler still left in the nasolabial fold. So whenever you inject a product that is safe and secure, that is actually giving the longevity of a satisfied period, then your patients can actually be very happy about your work and what you do to them. So actually creating the knowledge about the injection techniques, and then how those techniques can actually you apply to the facial features of both males and females, are helping you get the most of your patients and the likeness of yourself. So with this, I definitely wish to thank you so much for listening to me, but this is not the end, because now I will answer some questions, okay? So let me go back to my slide, okay? So do you hear me? Do you see me? Okay. So let us see if there are any questions. Well, actually, there's only the thank you note about the presentation. Thank you about the presentation. Well, it was actually my pleasure. I'm very, very sorry about what happened due to the technical reasons. And if you have any questions, please. You saw my Instagram account, you saw my Telegram account, and of course, you can definitely see that you can message me, and I would be glad, very, very, very glad to answer all of your questions. There's one more question that actually says, thanks, doctor. What about the injection filler after lipolysis? So actually, I would not do it the same day because you don't see the appropriate volume after the lipolysis. So what you do, you wait until you get the proper volume that you are satisfied, and then inject the filler in the proper way. Specifically, when I do the jawline, the patients come to me and say, I would like to do a jawline. I said, okay, no problem. I will gladly do that. But you have here the jowl. And that jowl is something that you have to actually together, we have to take in an account. So what I do there, I inject the cell booster shape to decrease the size of this area of the superficial fat that actually is here. And then when I remove that, also improving the quality of the skin, after that, I inject the filler and everything looks much, much better. Okay, we have another question. The other question is, again, about lipolysis. Then we have one question about the size, whether the size of the cannula, and do I use a needle or a cannula? So the question to that would be, I use both. Specifically, I prefer to use cannula in the mid and lower phase because it gives me definitely the opportunity to be the most safe, and also the minimally invasive, because with the one injection point, you go all the way to the different parts of the face. And then I also use the needle in specific parts, like I like the needle in the lips because it gives me the opportunity to use a 33 gauge needle with the both Apriline normal and Apriline Forte. But I have to take you that there is a certain technique actually with the needle to have the appropriate process for you, not to be hard and very tough for you because of the difference. But this is completely a different story about the injection technique. And this is also the thing is, so with a needle, I go with as small enough. And with the cannula, the question of the size is usually I like a bigger cannula. This is a 22 gauge cannula, mostly 7 centimeters, so 70 millimeters in length. It gives me the opportunity to go as fast. Okay, another question. Another question is about the possibility of vascular occlusion. Of course, this is not due to the filler itself. It is due to our technique, and of course, probably some bad luck that gave us the opportunity to inject it with the needle inside of the vascular vessel, usually an artery, but can be a vein as well. And this is not something that also happens just with the needle, but also with the cannula. So you have to be easy. You have to be slow injector, and also to respect the anatomy. Okay. And are there any questions? Okay, that would be for that. Okay, so there's so many things that I don't know. But what I did know is shared with you. Hopefully, you find that in this hour, you actually have something that is now in your mind, helping you to actually achieve a higher level of injection and understanding of injection techniques due to the understanding of the gender differences between males and females, because we definitely want a majority of actually us want to stay on other side of the story, to being either males or beautiful females. Of course, there are other in-betweens, and I don't have anything against that as long as it's consensual. So, all the best, take care, and good luck in everything that you do. Thank you so much for listening to me once again.